Good evening and welcome to our town hall focused on planning for spring 2021 undergraduate students at Johns Hopkins University. I'm Janet Schreck, Associate Vice Provost for Education and faculty member in the School of Education. I serve as one of the team members leading our 2021 planning efforts, and I'm honored to be moderating this evening's town hall. With our shared commitment and dedication to following best practices in containing the spread of the COVID virus, as well as the added support of a broad-based COVID testing program, last week we announced our plan to prudently and safely move to a more extensive on-campus experience for the spring semester. Our goal this evening is to answer your specific questions about plans for the undergraduate education and student life experience. Joining me this evening on our panel are many of the university leaders responsible for implementing our spring 2021 plans. In a moment, I will introduce each panelist who will provide key information and updates regarding his or her primary area of responsibility. We are also joined by additional critical team members who are off camera, but available throughout the evening to answer questions. In our announcement for this session, we asked you to send us questions beforehand and have appreciated the many that we've received. Below this screen is also a box that will allow you to send in questions in real time. We will answer as many of those questions as we can. Like our other sessions, this town hall is being recorded and will be available for asynchronous viewing. I'm now going to introduce our first panelist, who is Stephen Ganji, Executive Vice Provost for Academic Affairs and Professor in the Bloomberg School of Public Health. As co-chair of the JHU Coronavirus Planning Task Force, Stephen will share with us a high-level overview of the Spring 2021 plan, as well as the rationale supporting it. Stephen?
Thanks, Janet, and thank you all for participating this evening. We wanted to start by giving you just a broad outline of our rationale for opening this spring. Of course, we're all monitoring the COVID pandemic. And, I think it's fair to say the pandemic here in the United States is not where any of us would want it to be. We're carefully following cases here in Baltimore and Maryland, as well as across the country and indeed across the world. We've been closely communicating with our health advisory group and other experts to help us determine where the pandemic may be going, both in the short term as well as over the course of the spring. I think our overall assessment is, clearly that we expect post January 1st there to be a small surge in the pandemic across the country, just like we did see in the post-Thanksgiving period. However, based on what we saw on Thanksgiving, we did not see a substantial, remarkable increase in the number of cases. Of course, things remain to be seen how things will proceed after over the course of the next several weeks. But our forecasting and models give us some hope that the pandemic will not be surging to a much greater capacity. And over the course of the spring, we anticipate the wind to be at our back between the opportunity for distancing as the weather improves, as well as vaccine rollout. That gives us some hope that the beginning of the end of the pandemic is here. Alongside all of these forecasts and anticipated trends, we heard a lot from our students. Our students have told us clearly that they are interested in returning to campus and returning to an on-campus experience. Certainly, they and all of our faculty have performed heroically for trying to make the best of the fall term. And for the most part, students have reported that they were able to achieve the learning objectives of their classes. But as you all know, and we all know, our students are anxious to return. And so all of our preparations have been to try to make that happen as safely and as much as possible. We had, prior to fall, a lot of our policies and procedures in place. We had an ability to de-densify our campus to a significant extent with movement of many of our classes to an online modality. We worked with the faculty and programs to define those set of courses that would make sense to be in-person modality. We also implemented many policies and procedures for enhancing the best public health procedures, such as masking across universal masking, other de-densification and distancing requirements if we had planned to come back in fall. We ultimately made the decision not to, but since that time, we have been learning from our own on-campus experience. Again, remembering that while we didn't have classes occurring online in person, we did have a substantial amount of in-person research that was going on. From that experience, we really saw the value of the impediments and barriers that we put into place for preventing on-campus transmission, to the point that we have not seen any transmission amongst in the workplace, in the research environment, and in the limited on-campus instruction that we did have that was going on in the fall. We've also been in great contact with our peers, seeing how they have succeeded or been challenged. Again, I think what we anticipated and put together a plan that met the best approaches from each of them. So all of the work that we did in preparation for fall, coupled with improved capabilities for spring, we believe are the best measures that are available for bringing students back in a couple of weeks. Let me just touch upon some of the improved capabilities that we've implemented for this spring, and you'll hear about some of these later on as well. We've instituted state-of-the-art saliva COVID testing, starting with the building a brand new high-throughput COVID processing lab that's staffed by the Johns Hopkins Hospital. We're establishing multiple specimen collection sites, 5 on the Homewood campus alone, as well as other parts of the university. We've hired over 30 staff and trained them to be part of these specimen collection sites. We've implemented all of the testing that we're doing within our Johns Hopkins Epic MyChart system that serves the overall hospital needs. We've increased our laboratory capacity to more than 4,000 tests per day with less than 24-hour return, allowing for us to implement a mandatory testing of undergraduates twice a week that may be able to be surged if we needed to for hotspots. We've secured genetic testing to allow for the identification of new variants. Many of you have seen in the last several weeks the concern about new variants of COVID. We will have testing that will allow us to track this amongst our campus individuals who are tested positive. We've worked with schools to ensure that they have clear policies about what the mandatory and voluntary testing will be. We are expanding a variety of novel methodologies, such as wastewater testing in our campus residence halls, and have been expanding our program for compliance, monitoring, and enforcement. All of this comes with additional people who are on campus. We've tripled the number of safety ambassadors. We've attentively expanded the amount of housing that's set aside for quarantine and isolation. We've hired new case managers and increased our supply chain for all of the key supplies that we need nowadays. We've built a new structure on the Homewood campus that will help us de-densify activities, and we've integrated many of our IT and security systems so that the campus pass that you have will be integrated with our readers across campus. We've, as many of you know, implemented mandatory flu vaccination policy. We've enhanced our Johns Hopkins Clinical COVID Center with the implementation of a new clinical management system that's integrated with our other systems. We've ensured that the operations of that system will be world-class with appropriate staffing and technology and monitoring opportunities so that we can track very clearly if and when cases are occurring on campus. We've been more transparent in how we release these data. So we've revised our COVID dashboard that is public facing and allows all of our community to monitor the occurrence of COVID on our campus. And based on the work that our students initiated in the fall, we've actually expanded and developed a new university-wide social compact to emphasize all of the things and buy-in that we need to have across campus in order to come back safely. So that's a summary of a lot of work by literally hundreds of individuals for ensuring that we are coming back as world-class and as safely as possible. Janet, let me turn things back over to you.
Thanks so much, Stephen. I'd like to next introduce Kevin Schallenberger, Vice Provost for Student Health and Wellbeing, who will remind us about the testing plan for undergraduate students, as well as some of the expectations for quarantine and other things when students return. Kevin?
Great. Thank you, Janet, and good evening, everyone. Just to remind you, Student Health and Wellbeing provides a range of primary care and mental health, disability services and accommodations, and overall wellness programs and services. And in the spring, we'll continue to provide telehealth and teletherapy and virtual wellbeing programs, as well as some limited in-person services and programs. But I do want to just emphasize we're not taking walk-ins to those clinics. Students do need to make appointments first. I want to just go into a little more detail with some of the stuff Stephen talked about. Like he said, we have greatly expanded our asymptomatic testing program. And I'm going to go through some of the requirements and logistics, and then happy to answer additional questions. I have some of my colleagues who are also on the panel, Julie, Katie Ray, who's coordinating our asymptomatic testing, and Dr. Roanna Kessler, who's the director of our Homewood Health Center. But like Stephen said, just an overview of our testing program. Our undergraduate students do need to participate in a twice-a-week asymptomatic testing and receive at least 2 tests that are 48 hours apart, where they receive a negative result before participating in any in-person classes or JHU-sponsored activities. I will say, we often will say negative result, but in your My Chart, it actually will say not detected. So that means when we say negative, we've been using that term a little bit interchangeably. Those students who are currently in Baltimore, we strongly encourage you that you start your twice-a-week mandatory asymptomatic testing now. Our sites are open. And like Stephen said, we have 5 asymptomatic testing sites on Homewood campus to make it convenient. But just do keep in mind that if you are currently in Baltimore, it is required that you start your testing program the week of the 18th. If you have not arrived yet to Baltimore, we do encourage you to obtain a COVID test 72 hours before traveling, which is the recommendation of the state of Maryland. And there were several questions about this. You do not need to submit to us proof of that test. We just are asking folks to do that. Again, it is the recommendation of the state and just good public health practice. If you need some help or assistance in paying for that test, financial aid can assist. You will also, we had several questions. If we get the test 72 hours in advance, do we still need to quarantine when we come to campus? And you will still need to quarantine, and I'll talk a little more about that. Residential students, you will be tested upon arrival as part of your move-in appointment. So when you make your appointment to move in, you will be tested at that time. After you're tested, that is when you get your keys to move into your residence halls. You will then need to quarantine in your room for 24 hours until you get that first result and are cleared, with the exception of picking up food. So there's been lots of questions that once I get into my room, can I go pick up other things or go shopping or have dinner with my family? You should do all of that prior to your move-in date. Again, once you set that move-in date, you get tested at Schreiber Hall, you'll move into the residence halls, and you'll need to quarantine for 24 hours. At that time, you should have already received an email how to sign up for MyChart, where you will schedule your appointment for your second test 48 hours after that first test. And then you will continue to schedule your regular twice-a-week testing through MyChart. Couple of other questions. If you tested positive for COVID in the last 90 days, are symptom-free, and have completed your isolation period, you do need to email documentation of your results along with your name, date of birth, and when you were tested, when you got that positive COVID result prior to arrival. So in the letter that you received from us, it has the address for student health and well-being that you need to send to us, because that will change your testing schedule. You will not be part of the regular testing for a period of time. I do want to emphasize students who have symptoms, just much like in the fall, will continue to call the Johns Hopkins COVID call center. And we have a whole team of people there to assist you and help you provide medical management and support if you do test positive, which includes quarantine and isolation housing. And I know one of my colleagues will talk more about that. Lastly, please remember to complete your pre-entrance health forms. And again, I want to reiterate what Stephen said, the flu vaccine is required this year. Although we will have flu clinics during move-in, I really encourage you to get your flu vaccine prior to come to campus. And the reason for that is sometimes people will have small side effects when they get their flu shot that look very much like COVID symptoms. So we really encourage you to get that flu shot prior to arrival. But again, if you cannot, there will be opportunities to get that flu shot during move-in. So I'll turn it back over to you, Janet, and then happy to answer any more questions.
Thanks so much, Kevin. I'd like to next introduce Alana Shanahan, Vice Provost for Student Affairs, who will provide a high-level overview of plans for student and residential life. Alana?
Thanks, Janet. So just obviously excited to be welcoming everybody back, to the students and the families on our Zoom tonight. We're thrilled and we're in I think, great shape as far as our preparedness for your arrival. So I'm actually not going to spend too much time chatting tonight. I want to turn it over to my team. They're the experts. I think they're going to do a wonderful job of fielding your questions. The one important thing I do want to share is, if by chance at the end of this town hall, which I fully expect we're going to cover a lot, but I'm not sure we'll get to everything, I do want to encourage you to reach out to any of the professionals that you see on the Zoom. But if you're struggling and you're lost and you can't remember, if you could just remember my name and my office, bring that question to me and we will be sure to farm that question out and get you a prompt response. I know this is a challenging time as far as the amount of information that's coming to you. And I know it may feel like things are moving at a frantic pace, but I do want to give everybody confidence that we're going to do our best to answer your questions tonight. But tonight is not the only opportunity. So remember, Vice Provost of Student Affairs Office, you can Google it at JHU. You'll find our contact information. Please don't hesitate to be in touch with us if you have questions after tonight. Back to you, Janet.
Thanks, Alana. I'm going to next introduce and welcome Andy Wilson, Dean of Academic and Student Services. And Andy, I think you might be one of our people who's going to have a lot of speaking time tonight. So I'm hoping you can help us with some updates and coverage of dining and residential move-in.
Great, thanks, Janet. Good evening, everyone. It's nice to be talking about the plans that we're going to be executing in the next few days. My role is to work with some of the foundational services, so housing and dining, as well as some of our services and programs that really help students find their sense of belonging and maximize their potential, like our orientation program. So many of the things that we've been working on and we'll execute in the next few days have to do with your pre-arrival. So if you're planning to come to Baltimore, you already have and you live on campus, whether you're a new student or a second-year student, you have your room assignment. You should already have your move-in appointment. And now you're starting to think about the packages that you want to mail, and you can go ahead and send those. You use your address, which is your room number, and they will get to the appropriate mail room. You will need to wait until your first negative COVID test to go retrieve those items. So as you're packing those items, just be aware that the things that you bring with you in person need to account for things that you'll need at least for the first 24 hours. When you arrive on campus, you'll go right to Schreiber Hall. And if you're driving, the South Garage, and if you're coming from the airport or the train station, it's your responsibility to get here. But once you get on campus, we're going to help you move from Schreiber to your residence hall. So if you will provide JHU transportation, or direct your family members or your car to the appropriate residence hall. At Schreiber, you'll get your test, which Kevin talked about. You'll also get a very hearty welcome from the staff. We're trying to make this as welcoming of an experience as you can. You'll get your wellness kit. You'll get your traditional JHU scarf. We really want this to feel more like a spot of welcome than a doctor's appointment. And the staff is very excited about this and is really doing a very good job. Currently, I'm seeing in the testing sites of making it feel as fun and welcoming as possible. Then you'll be directed, you'll get your key at the end and your hearty welcome, and then you'll be directed to your residence hall. And there's lots of ways that we will help you get there. There'll be maps, there'll be literally people around campus to direct you, as well as transportation options for those of you who will need it. Once you get to your residence hall, there's another hearty greeting by the staff. And certainly the residential life staff is incredibly excited about this moment. And they will help you with any questions that you have. Unfortunately, we're because of the public health guidance, the students are the only ones allowed into the residence halls, and it also prevents us from providing our traditional moving support. So the move-in will include large moving bins that can be used multiple times. They're cleaned between users by our custodial staff. But one of the pieces that is very different is that because of the public health guidance, really we are limiting the residence halls to the students. Certainly we will be available to answer questions with family members outside, but really we need to make sure that any of the things that you need to do before you go into the residence hall, you've kind of taken care of. So the multiple trips, we will have people on staff to provide answers, but it is going to look a little bit different. So we are also imploring you to please pack lightly because we won't be able to help, because there are some of our residence halls that make it more complicated. The AMRs, for example, is not a building that has elevators. So we're trying to be very clear that we want our students to understand that this is not the moment to bring the entire kitchen sink with them. So once you're moved in, you will, in your first 24 hours, be able to access our dining program. It is in a grab and go format because of public health guidelines, so we don't have any in-person eating. The misnomer on grab and go dining is that it's somehow a Lunchable or a cold sandwich, and it couldn't be any further from the truth. We are still committed to our high levels of culinary excellence, and we're going to continue to provide dining options for students who have special accommodations, vegetarian food, hot food, a variety of nutritious, delicious food. The format is really what is going to be different because of the public health guidelines. And we are prepared that if the public health guidelines change, to offer some limited in-person dining, but those plans are not available in this moment. All of the meal plans will be activated on January 16th for students. So when they arrive, they'll immediately be able to use their meal plans, so there won't be any lag there. And we're keeping Nolan's open for all meals where it was normally only open for dinner. So our 2 residential dining facilities, Fresh Foods Cafe and Nolan's, will be open along with our retail complements. So we've covered food, we've covered housing, and now for our new students, orientation, which they have been a part of since July, and they have made what I heard some first-year students say on Friday is their virtual friends, and they're so excited to meet their virtual friends in person. And we're certainly, once the public health measures have been satisfied, then with 2 negative COVID tests, then we'll be able to gather them in person. Because students will be coming and moving in on January 16th, 17th, and 19th, there won't be move-in on January 18th because of Martin Luther King Day. We're looking at orientation as a cohort-based model. So as you arrive, you will have a schedule for that cohort, so kind of group A. And it'll be a mix of virtual programs and one-on-one contact with either your resident advisor or your first-year mentor each day. And then as those cohorts, kind of several days later, become able to gather them in person, we're going to do that to have some FYM meetups. So we're going to be offering campus tours in person, a community walk of Charles Village, and the FYM meetups in person, as well as virtual social programming every night, as well as some content-based program around key issues and some fun things like arts and a cappella. So we're very excited with making sure that the sense of belonging and basic needs of our students are met very early. And there are a lot of details, and I know a lot that's on the mind of our families and our students, and I'll be happy to answer questions if we didn't in the future. So I'm going to turn it back over to Janet.
Thanks, Andy. I'd like to next introduce Mita Ruzika, Dean of Student Life, who will tell us more about student engagement plans for both students living with us in Baltimore, as well as those who will be with us remotely or online. Smita?
Thank you, Janet. Good evening, everyone. We are so excited to welcome you and your families on our campus as you move in the next week or so. And I know that so far, what's probably most front in your mind are some of what we call in the Maslow's hierarchy of needs, the basic needs that Andy just talked about: food, housing, testing, quarantine. So you may not be thinking past what happens after you or your student is settled in. But I do want to give you a very high level preview of what to expect and what we're planning. We've had a great fall semester as a wonderful opportunity to really practice and refine the ways we virtually engage with our students. And with that, I would offer that 90% of our programming will continue to be virtual. So those students that will not be on our campus, that may be living internationally or have chosen to stay at home, are still going to be provided a very robust opportunity to engage with the Hopkins community through both large-scale programming as well as smaller, more intimate cohort-based programming. And just to kind of think about the large-scale programming, springtime is the time where we have a lot of our traditions and events that focus on class celebrations, like our senior class council and our junior boat cruise, or our spring fair, which this year it will be the 50th anniversary for it. So we want to continue with the spirit of our traditions and having that opportunity for all of our students. We're going to start the beginning of the semester with mostly all virtual programs, especially those large scale programs, because even though many of you will be on campus, it is important to understand both the Baltimore City as well as Maryland laws around gathering. And we want to make sure that we are abiding by that. But our hope, and we are really optimistic that as the weather starts to warm up and the public health outlook hopefully starts to look good, that we can provide more in-person opportunities. But regardless, we will always have virtual programming options for both students here as well as abroad or around the country. I also want to specifically talk about the students that will be moving into the halls. You are going to be greeted by, as always, a team of peer students who are there as a primary anchor, a go-to person, and those are your resident assistants, or as we call RAs. These are your peers, upper class students who live in the halls with you, and so they will be there to welcome and help you. I know as I've looked at some of the questions and comments, it is tough that parents and families are not going to be able to go in and be able to help their student, but I want every parent and family member on this call to know that we will be there to help and support that transition. We did this in a smaller number in the fall with some of the small numbers of students that did move into our residence halls. And we made sure that families and parents did get some time to say goodbye to their child, and also had staff on site to answer questions and to clarify some things. So know that your child and your student will be there with a community of folks who are ready to help you. As with traditional sort of move-in plans, we typically have floor meetings for our residents as they move in for the first time. We are going to have virtual floor meetings. So in those first few days, as your student is in quarantine, I think one of the things I really want to underline is while they may be physically distant, we are making every effort to make sure that they are socially connected. And so every student who will be living in the residence halls will have virtual floor meetings with RAs. They'll get to know the folks on their floors virtually, and then hopefully start interacting with them in small numbers. And again, we are going to do a lot of program for our residential students that are going to be virtual, and then very small in-person programs as well. Going back to sort of kind of the level of care and support, I do want to briefly also talk about the fact that we have a team of professional staff who are also there to support your student if they have to quarantine and isolate beyond those first couple of days. So if at any point during the semester a student has to quarantine because they have been exposed to someone who tested positive or test positive, we have quarantine and isolation spaces, and we have full-time staff who will become sort of their primary case manager to help them through the time that they are in quarantine and isolation. We also are going to provide counseling support groups, opportunities to interact with our chaplain if a student wants that opportunity while they're in quarantine, again, virtually. So there is a really, really robust network of folks, both peers as well as professional staff who are there to support your student. And then finally, we have over 400 student organizations who are really, really excited to engage with you students in all the activities that happen in the spring. Student organizations, again, will continue their operations mostly virtually as we go through the semester. We are hoping that there will be more opportunities for smaller in-person events and gatherings hosted by our students. We're also going to do events where there is some sort of a pickup component, where maybe you're learning how to bake a cake. And well, maybe not the cake example is probably not good, but doing some sort of craft. And then you can pick up the supplies and then actually go and do the virtual program back in your rooms. So we are thinking about how to sort of continue engaging our students. I will, leave the questions and our plans for our athletics, our facilities around recreation to my colleague Jen Baker, who can talk more in detail about that particular piece. But I think what I really just want to say to you is we are thinking about the importance of a robust social engagement plan for your students. Beyond the testing and the move-in piece, we know that your students are going to want to engage with their peers. And I think it's going to be a partnership with you students to make sure that we're helping you connect with one another in a safe but also meaningful way. I'm happy to answer more questions as they come in. You can always reach me personally also, and I look forward to seeing you in the coming week. I'll turn it back to Janet.
Thanks, Mita. You actually gave me a great segue to our next introduction, which is Jen Baker, who is our Director of Athletics and Recreation, and will tell us more about the plans for athletics and things like the rec center. Jen.
Thanks, Janet, and hello to everyone out there watching. Happy to answer some questions about what athletics and recreation will look like this semester. I will start on the recreation side. So as you're likely aware, we have the Ralph S. O'Connor Center for Recreation and Wellbeing, which will look a lot different, COVID notwithstanding, because over the summer, while everyone was away, we've started to make substantial progress on our expansion to that facility. So when you come back, expect that it will look very, very different. We are very excited about that project and expect it to be completed later this year. But our recreation center is still functional, and we do expect and plan to reopen it. Likely not on the day that you move in, but shortly thereafter, we plan to do that. And it will look a little different, as you might imagine. So we will operate at a reduced capacity within the facility. Everything will be controlled by an app that you will download, and it will allow you to reserve time in the recreation center, either on the cardio side or on the strength side. And you'll see when you come into the center that we have spread out all of the equipment on the main gym floor that's in there. So there is significant distance between pieces of equipment. You will be required to mask at all times while in the facility, and you will reserve 45-minute blocks. And you'll do all of that through the app. The app will allow you to reserve 24 hours prior, and you may reserve up to 4 spots in a given week. So we're hopeful that that will give everyone an opportunity to access it. So all students, faculty, staff, very excited to welcome you back there. In terms of other recreation programs like club sports and intramurals, we still haven't made a final determination on that yet. And I don't expect there to be what I would call a final determination. We're hopeful to return things back that we think we can do safely in various phases over the course of the semester, but much of that will be dependent on facility availability. And so to start, when you first come back, we do not anticipate offering any intramurals or club sports, but we certainly plan to continue to reevaluate that and to open up those opportunities as our facility space allows, and certainly as the public health situation allows. Shifting over onto intercollegiate athletics, very excited to welcome student athletes back to campus. As most of you who are student athletes may be aware, the Centennial Conference, which is the conference that most of our teams compete in, made the determination earlier this year that we would not have fall sports, and they would not sponsor fall sport competition, I guess is the best way to phrase that, or winter sport competition, but they left it to the discretion of the individual institutions as to whether or not they wanted to try to compete sort of as an independent. So I'm gonna put that in place for a moment and then let you know that this upcoming week, we do expect the Centennial Conference presidents to meet once again and have a conversation around spring sports as part of that meeting. We don't know what will come out of that conversation, but we're prepared no matter what. So for right now, I can't give you specifics in terms of what sports are going to look like, other than to tell you that it is certainly my hope that all of our teams have the opportunity to compete in some capacity this year. And certainly the further we get into the semester, that opportunity, I think, increases with what we hope will be an improving public health situation. In the meantime, we will try to return our student athletes back to practices and workouts in a safe fashion. And I can't promise you when that's going to start exactly. But what I can tell you is you should expect that it will be in small groups, physically distanced and masked. I don't anticipate that to change at all. We have a number of plans sort of put in place, and once the Centennial makes their determinations this week, then we'll have an opportunity to start to move some of those forward. And I would expect sports to come back kind of in what I would call a phased and reintroduction. So stay tuned, but I do certainly hope to provide opportunities for our athletes to reconnect with one another, reconnect with their coaches, and get back into our facility in some way, shape, or form. The one thing I will add to that is that your athletic trainers are still available to you as they have been this entire semester. All athletic training will happen by appointment only. So no longer can you simply come into the facility and walk into the training room. You should expect that they'll be in touch with you if they haven't already about going through the medical clearance process when you come back. And locker rooms will not be open in the traditional sense. So if you need to store equipment in there, you can expect that you can go in, drop your equipment, but then you'll have to come right back out and exit the facility. And obviously we're doing that just to make sure that there's a minimal number of folks within our spaces and to keep focused on de-densifying everything. But excited to welcome you back and excited for what lies ahead this spring. So with that, I will turn that back to Janet.
Thanks, Jen. We're going to move on now to Jim Braylor, who is Associate Vice Provost for International Programs and Student and Scholar Services. And Jim's going to give us a very brief update on current guidance for international students hoping to join us. Jim?
Yeah, thank you, Janet, and good evening, good afternoon, or good morning, depending on where you find yourself in the world right now. So far, the Student and Exchange Visitor Program, which administers the F1 International Student Program in the United States for our international student population, has not yet issued a formal notice on their website as to the SEVP guidance for spring. However, they have intimated to our professional organizations that the guidance that was in place for spring 2020 and modified for fall 2020 should be expected to continue for spring semester. So that means any new students that started abroad in the fall remotely that wishes to come for spring only has to meet two stipulations in order to be able to enter the country and enroll. And that is that their program is not 100% online and that their course schedule is not 100% online. For continuing students that were students enrolled last spring, 2020, the guidance again is that you may be fully remote. So you may be fully online wherever you are in the world, even in the United States. So for those new students that wanted to enter for spring, if you have been able to secure an F1 visa, which is quite difficult right now, we absolutely understand that. Many consulates remain temporarily closed or open for only emergency services only, which tend to prioritize US citizens and permanent residents. But if you have been successful in getting a visa appointment and getting the visa in your passport, you have your valid I-20 for spring arrival, we would encourage you to, of course, finalize your plans and arrive as soon as possible, given that undergraduate courses are currently planned to begin in person or offer a hybrid modality for spring. So that's the essence of what I need to share. Naturally, if you have any questions, we want you to reach out to the Office of International Services, ois.at.jhu.edu, with your specific questions, because it can vary tremendously by country. There are not only the consular issues, but there are still COVID travel restrictions depending on which country you're a citizen of, and not to mention, travel difficulties just getting a flight to the United States. So please reach out to us if you haven't and you have questions about your planned arrival and any of the requirements that you need to meet in order to come in for spring. Thank you, Janet.
Thanks, Jim. We're going to move now to introduce Jessie Martin, Assistant Dean for Advising in the Krieger School of Arts and Sciences, and Janet Wise, Assistant Dean for Undergraduate Academic Affairs in the Whiting School of Engineering. Jessie and Janet are available to tell us more about specific aspects of students attending their courses, the grading policy, how students will know if their classes are in person versus remote, and lots of details like that. Janet and Jessie.
Thank you. My name is Janet. I will be leading this first. Everything that Jessie and I talk about is applicable to both arts and sciences and engineering students. The academic policies and things that are in place for the semester apply equally to both groups of students. So whoever is on the screen or online, that's just for you to know that. I just want to reiterate, classes are starting January 25th, and that first week is online. Starting February 1st, classes will be beginning in person for those that are identified with an in-person component. Jessie will talk a lot more about the teaching modality of the courses this semester. And I just want to reiterate that you do not have to come to campus in order to participate in your coursework, even if it is designated as in-person coursework. There will be remaining or existing remote options for you to participate if you are not able to come to Baltimore to attend classes. And then I'm going to leap all the way to the end of the semester. Many students have been inquiring what will be the grading policy for spring 2021. So now I'm talking about May and June, and we're all going to get there and be happy when we do. The grading policy for spring 21 will be the same as what we had for fall 2020, where the default grade for classes will be satisfactory, unsatisfactory, and students will, via a sign-on in SIS, have the opportunity to choose letter grades for as many or as few courses as they wish. Rather than one deadline, which for the fall was today at 5 p.m. Eastern Standard Time, the deadline for May, due to May graduation, the large number of students who complete degrees, we will have a 2-tier deadline, and this has been emailed to students today, actually. So May graduation candidates will need to make their grading decision choices by May 19th, all others by June 3rd. This is not the only time you're going to hear this, but I know students have been wondering. So there you have it. And I will now turn it over to Jessie for a little more information about modality and academic support.
Thanks, Janet. So Janet talked a little bit about, when February 1st comes, that the courses that are slated for in-person modality will start. Students can see their instructional delivery method by logging into SIS, going into the course description, and in its own little space, it'll say instructional delivery method. And there's a whole range of things that you might find there. There's some that are on site, and that's pretty easy to tell that that's going to be an in-person class. We also tried to identify which online classes were synchronous or asynchronous, or maybe they're mostly synchronous with some asynchronous or vice versa. So that's to give students just a really good indication of what kind of class they're signing up for, and if they're going to have to participate in person or online, and if it's online, is it at a specified day and time, or is it going to be completely asynchronous and just have content posted? And Janet also mentioned, and I just want to drive the point home, that students can participate in on-site courses remotely. We are recommending that students email their professors for those in-person courses and identify themselves as a remote learner and start the conversation with the professor about what a remote participation in an on-site course would look like, so that they're prepared for that. And one other thing about course modalities is that some students might be interested in registering for courses with conflicting times. This is possible for you to register in courses with conflicting times in SIS, but it is against our policy to do so. I know some students would like to participate in courses with conflicting times if maybe one or both of the courses are asynchronous, and we're just asking students again to contact their professors, get permission as an exception if that's something that they would like to do. I'd also like to just talk for 1 minute about our academic support programs like Pilot, the Learning Den, personal tutoring, and study consulting. So same as the fall semester, we will be offering those services once again in the spring. The default method of delivery for academic support is going to be online. It worked really well in the fall semester. We may have some on-site academic support programs like Pilot, and we're trying to go through our plans right now and see if that's something that we can do. And we will get that information out to you soon. Janet, did I leave anything out? Anything you want to add on to that?
I have just one quick comment on the instruction methods that Jesse described. In the advanced search tool in SIS, when you're searching for classes, you can search for instruction method. So if that's something that is deeply interesting and concerning to you, talking mostly to students right now rather than parents, you can search for in-person. I'm a hybrid of in-person and synchronous. You can search through every modality that is being offered this semester. So make use of that if you need something specific. That's it.
Okay, thank you very much. And thanks to all the panelists for all that introductory information, which I think tackled many of the questions that we had received prior to this evening. But we've gotten a lot more, and I think we need to reemphasize and explore some points a little bit more in depth. So I think I'm going to start with move-in day. We've had a number of questions or requests for clarifications about move-in day. So I'm going to put Andy on the spot first, but allow him to kind of redirect to other people if you think it's appropriate. Andy, can you talk a little bit more about what it's going to look like for students and parents on move-in day? Can parents come into the dorms? Can parents be on campus? You know, what does that first drop-off period really look like?
Yes, so it's certainly something that we have thought a lot about. We do think that, you know, families can be outside on campus and moving around in, you know, the outdoors is certainly a different calculation of risk than going into the residence halls. So we've made the unfortunate decision based on public health guidance that no visitors can be in our residence halls, and really none of very few of us are going in, and just to make sure that it's a safe haven for our students. So it is a dramatically different type of move-in than the typical rites of passage with college move-in day. And it's something that we know is a bit of a strain and a pain point for families. We do want to make sure that families have the opportunity to say goodbye to their students if they're with us, if the families came with them. So doing that outside the residence halls before the student goes back inside is what we're hoping. So really the cadence of the day is to, take care of any kind of, loose ends before you come to your appointment. Your move-in appointment, which is 30 minutes, is just the time period in which you kind of start your interaction on campus. Certainly there's not a clock that's ticking and you only have 30 minutes to move all your things in. And then you'll do that at Shriver, then you'll move to your residence hall where the student will move their belongings in and then bid their farewells. Then the student is allowed to go and get their food, but really we're asking that they self-quarantine until they get the result of their first test, which we think will be about 24 hours later.
Thanks, Andy. I'd like to follow up now on that 24-hour piece, and I'm going to ask you and Kevin and others to chime in on this because I think people are struggling a little bit with the concept of this 24 hours. So can we talk a little bit more about what students can do and can't do in that 24-hour period? Can they leave to go get food? Can they leave to go to Target to go get, supplies? Can they go pick up bedding from the shipping office? What happens in those 24 hours?
Well, we certainly want them to know that they can go get food. Right? Like that is our number one concern. that students have asked us about, and that we are making in some ways an exception that maybe Kevin can talk a little bit more about, because that is really the only reason why we want students moving around before they get their first test result. So Kevin, you want to talk a little bit more about our rationale there?
Yeah, that's correct. Part of this is public health guidance, knowing unfortunately that students could get infected during that travel period, which is why we are doing the 24-hour quarantine. We are expecting once they're in the room, they stay in their room, that they don't even move around the building, again, with the exception of picking up their food. There were also questions about what happens between the first negative test and the second test. We are not asking them to quarantine between that period. However, again, from a public health guidance, we are asking that they do, restrict their movement. We are saying that they cannot participate in any in-person classes or Hopkins events until they get that second negative test.
Thanks. I'm going to jump to another question that was quite popular in the beginning of the evening, which had to do with refrigerators, and ask, I think it's Andy, but again, I'll let you pinpoint somebody else about the policy for renting or not renting refrigerators.
Yeah, so normally we do rent refrigerators, but again, we're not allowing anyone who doesn't live in the residence hall or an essential staff member in the residence hall into the residence hall. So we're not renting refrigerators or having them delivered. Now, thankfully, one of the realities of our decompressed campus is that the vast majority of the spaces that students will be living in have a refrigerator provided. So certainly with really any of the housing related questions about your room and the various configurations or what it looks like, what it has in it, certainly our housing staff is very interested in talking to students and families about what is already in the room, so that families and students can plan. So no renting, but the vast majority of our spaces already have them, so it takes care of that.
Thanks for that. Kevin, I want to do a couple of follow-up questions about testing and sort of preparing for testing. We had several people ask about the MyChart setup. And if I have a MyChart outside of Hopkins, do I need to set it up? Do I need to set it up in advance of coming to campus?
Sure, great. And Janet, can I just clarify the 24-hour quarantine question? Because we've been using 24 hours. We should actually be more specific. You need to quarantine until you get your first negative test result, and that we're turning those results around within a 24-hour period. So I know we've been saying 24 hours, but it's really until you get that first result and you're cleared. So the other, Janet, I'm sorry, just remind me of the second question.
So MyChart, a little bit more about, should I set it up ahead? And if I already have one someplace else, do I need to set up one for Hopkins?
Yes, it's a great question. And I realize many hospital systems use a MyChart system. We are particularly talking about you need to sign up for the Johns Hopkins MyChart account. You should have received email communication about that a day or so ago about how to go ahead and sign up for MyChart. If you were already a patient within the Hopkins system and already have a MyChart account, you may not have gotten another email because you're already in our system. I saw one of the other questions is if you're a residential student and moving in, you don't need to go into MyChart and make an appointment for that first test. You will automatically get signed up for that first test when you sign up for your move-in time. And then you will go into MyChart to sign up for that second test. And there will be folks there at Schreiber Hall if you have questions about how to do that. That can certainly help you navigate that if it's your first time using MyChart.
Great, thanks, Kevin. Stephen, we got several questions about vaccine and what the status of potential plans to vaccinate students would be and whether or not Hopkins would be in a position to provide second vaccines for some students who have been vaccinated for other reasons. Can you speak to vaccine and our planning for spring?
Sure. So let me just clarify, vaccines are distributed by the federal government to states. Every state has their own plan for managing how those vaccines are distributed within their state. So Maryland is currently in their first tier. They have a prioritization of vaccine distribution. Their first tier is for healthcare workers and residents and staff of long-term care facilities, as well as first responders. So we are doing vaccinations at Johns Hopkins Hospital and in affiliated staff that meet these requirements. As the vaccination for these groups completes and we move on to other tiers, we have a committee that's joint between Johns Hopkins Medicine and Johns Hopkins University for how to manage the further rollout and distribution of those vaccines. So the vaccine sign up within our healthcare system is actually within the same app, within the MyChart app. As other individuals will become eligible, communications will go out to them to allow them to go to the app and fill out questionnaires that identify themselves as eligible as per the Maryland guidelines. So more communications of that will certainly be coming out as vaccine rollout continues. I think it's important to recognize that as in terms of our plans for spring, our anticipation is that as happy as we are for vaccines to become available, and as hopeful we are that the rollout will continue at an increased pace, our plans are not determined really at all by vaccine distributions. We anticipate the procedures and policies that we have in place will continue for the duration of the spring term. Again, we'll be following this very closely, and if there's an opportunity based on the data to relax some of these policies, we'll certainly do so. But we anticipate it really, given the rollout that will be occurring over the next several months, it really won't be impacting our operations until fall.
Thanks, Stephen. We received a couple of questions asking again for the address of where to send proof of vaccination or proof of flu vaccination or COVID tests or things like that. So I want to share that address again. So you would send things to healthforms@jhu.edu. So healthforms@jhu.edu, no space between the words health and forms. I want to move on. We've had several questions about essentially what happens if a student would test positive. And so I think this is one of those questions that there's multiple team members who need to answer. And so I think, Kevin, I'll start with you from sort of the health perspective of what would happen. And then maybe Andy and others can follow up on, what will be the supports available to the students who do test positive.
Sure. Thanks, Janet. So if a student does test positive, you will be both notified again through MyChart, as well as one of our nurses will contact you and have a conversation around your health, if you have symptoms, how to best take care of yourself. At that time, if you are a residential student, you will also be moved to our isolation housing. If you are a student who lives off campus, our nurse will have a conversation with you about your ability to isolate in your apartment, and if you're able to do that based on public health guidance. If you're not able to, for example, you may have several roommates that you're sharing a bathroom with or are sharing a room with, We will also then be able to provide you the option of university isolation housing. We'll provide students transportation to that housing from either their dorm or their apartment to that housing. And then at that point, a case manager will be assigned to you. And we have a whole host of services, of everything from food and check-ins that we're doing. So I'll turn it over to my colleagues, but I will say that those students will have regular check-ins from our nurses to make sure we are monitoring their overall health. But I'll turn it over either to Andy or Alana to talk about the services that we're providing in isolation housing.
Sure, thanks, Kevin. So as Kevin mentioned, students who are required to isolate or quarantine have healthcare services, but they also have a suite of services that's delivered by what we're calling our COVID case managers. So basically, these case managers are there to sort of assist students with any kind of hiccups they may find along the way. Any assistance they may need connecting with academic advisors or faculty. If they want to, for our families that are on the phone, if students want to connect with their families, be sure that their families are aware of their status. That's something case managers can do. Case managers are also kind of just checking on the mental health of the student. Obviously, isolation and self-quarantine can be a bit of a grind. We want to make it pleasant, it's probably not the right word, but as pleasant as possible given the circumstances. We're encouraging students to bring obviously the materials they need to isolation and self-quarantine. But if there are things like an Xbox or a PlayStation that's going to make that experience a lot more positive, we encourage them to bring those too. We've also talked with our counseling center about their ability to provide support to some of our students that are in isolation and quarantine that may need it. So, and again, food will be delivered to their door and left by their door. So students who are in isolation or self-quarantine do not need to worry about exiting their residence. They'll have a menu. They can select their food from that menu. That menu will have a level of variety, given that obviously students are in isolation for more than just a couple of days. But we feel good about the measures we've taken to provide the students who are in that unfortunate situation with some really both strong supports, both on the medical care side as well as on the case management side.
Thanks for that. We've received several questions asking about students who had belongings left here from a previous semester last spring, and would they be able to access those? And I believe, and you all can correct me if I'm not getting this correct, that students should have been notified by email about how to pick up those belongings yesterday or around yesterday to today. And if you have questions about that, you can contact the housing office. Is there anything to add about that before we move on to some additional questions?
Yeah, you're exactly right. The email address that they could use is personalbelongings@jhu.edu, and the team is opening. There's a slew of appointments that they would make available to the students so that they can choose to, and we're working with students individually. So definitely, if you haven't made your appointment, get in touch with the housing team.
Thanks for that. We've had a number of questions about what other facilities will be open for students on campus. And I'm going to kind of punt this to the whole team because the questions have come in around, will the library be open? Will there be study spaces open? Not sure who wants to take point to kick off that response.
Janet, I can say, we've been in contact with the director of the libraries and they're finalizing their plans right now. And so those will be released shortly.
Thanks. And I imagine that's the case also for many of the study areas and places students are used to being able to access when they're here. Alana, did you want to add anything about that?
No, just to say again, we're looking to sort of finalize our opening plans, but the intent is to open many of the spaces our students have, beloved, whether it's Brody Learning Commons, whether it's the Rec Center, whether it's, we've built a temporary structure on our freshman quad that can, be a place for students, over 100 students to study. So we do anticipate those spaces opening, but that opening time frame is yet to be solidified. But we do imagine it will be, relatively close to the start of in-person classes. But do anticipate that everything will open. It's just a question of exactly when.
Thanks.
I do know that within engineering, we are working with faculty who teach classes for which students need access to very particular kinds of spaces outside of class time, things like mechanical engineering design labs and things like that. So anybody enrolled in those sorts of courses will receive very specific directions about how they will be permissioned into the spaces that have special equipment or things that they need outside of their class time to conduct their academic work. So that'll be class specific.
Thanks, Janet. I'm hoping we can tackle a couple more questions quickly. We did get several questions about students who know that their roommate situation has changed or suite mates have changed, and they're questioning whether or not they'll have any opportunity to rearrange their housing. Andy, is that you? I'm throwing that to again.
Yeah, I think it's, yes, they would certainly be able to talk with our housing office. We have a very fine assignments team that can work with students about their preferences and try to work with them individually. So reaching out to the housing office is certainly one of the takeaways from our time together tonight. And that is another topic that they would be able to help them with.
Great. We also had a couple of students ask questions about, is there an opportunity for them to move in beyond the period of time that was prescribed for move-in for various reasons? One, we've got some students who are ill with COVID and will need to be delayed, and other reasons. What would they do to make those arrangements?
Again, I think they would just reach out to the housing office. We're very prepared to do one-on-one work with students. We do it all the time. It's part of what our team is used to doing and something that they enjoy doing. So I think as people run into certain obstacles as it relates to their housing in particular, that team's available to really understand what the students and families feel like they're facing, and then provide a menu of options for them to choose from.
And Janet, if I can
Go ahead, Alana.
just add to that quickly, I think it's really important whether you're a student who's living in residential housing or a student who's returning to off-campus housing, we want you to have optionality. So if you need to join us at a later date, say mid-February, that's possible. I think what's really important is that you must have 2 negative tests under your belt, before you're participating in any kind of campus activities or coursework. So we don't want you to feel like you absolutely have to come right now, but understand that if you come on February 1st, you can't walk into a classroom on February 1st. You will likely need 4, 5, 6 days to ensure that you have 2 negative test results 48 hours apart before you have that opportunity to participate in on-campus activities.
Thanks. Andy, I'm not going to let you go. I have one more question for you, and then one more for Smita, and we'll probably wrap up. We've had several students ask if they are off-campus students, can they access grab-and-go dining or a dining plan of any sort? So
yes, they can use our retail dining. Our residential dining, which is Fresh Foods Cafe and Nolan's, is for our on-campus students only, just given the decompressed nature of those spaces and needing to make sure that we have the adequate flow for the on-campus students. But Charles Street Market, Levering, Brody will be open, and our off-campus students certainly are welcome.
Thanks. And I want to close with one more question that I would like to direct to Smita. We know that we have a number of students for a variety of reasons that can't join us back in Baltimore. And we've had several parents and students ask about a little bit more details on plans to engage those students and to make them feel like they're still part of the Hopkins family and the Blue Jay family. Could you talk a little bit about that?
Absolutely. And I think I want to reiterate that we know that many of our students are going to be outside of Baltimore, and we want to provide various opportunities and robust opportunities for students to engage, which is why majority of our programs that we'll offer, both large scale as well as small scale, are going to be virtual. So students will always have options to plug into a variety of programs. Even in this past fall, we have offered a robust menu of opportunities for our students and regular and weekly opportunities, from Wednesday night trivia to first run Netflix movie parties. And we're going to continue offering that. We've also learned a lot and gotten a lot of feedback from our students who have been engaging in virtual programming. And so as a result of that, we have invested in new technology. We've invested in new software that's going to make our programs more robust. We're trying to invest some technology with our arts programming as well, because our students are really missing a lot of the vibrant arts programs that we have offered pre-pandemic. So I think one of the best ways to sort of stay tuned into what we're doing in terms of programs is for the students to make sure they're in our Hopkins groups system, which is for our students. All you need to do is sign in with your JHU ID. You should bookmark it on your computer. We're going to be sending all students a weekly email about top events for the week. So you will also get something in your inbox. But Hopkins Group is your one-stop shop to really shop around for programs that are being offered. And then there are various offices that are within both student life as well as our academic partners that are going to be providing opportunities for students to engage with one another in smaller groups. So I really encourage you to explore those, bookmark those on your website. But we know how important it is for you to be part of it. And I think what I want to say to those of you that may not be coming back in our residence halls or are not going to be on our campus, we don't want you to feel like you're missing out. We are doing everything possible for that FOMO feeling to be non-existent. And so we are really relying heavily on our virtual programming. And even when we have in-person programs, for many of them, we're going to continue offering a complimentary virtual program so that our in-person students can still interact with our virtual students. That is also true for our student organizations, and that's another great way to really be engaged with the community, is by joining or continuing your membership in a student organization. If you have ideas for innovative ways that we can program virtually and have students stay connected, please again reach out to us. You are a great help in providing us innovation and creativity.
Thanks so much. So let me close this evening by thank you all for participating in our town hall. We received a lot more questions, many more questions than we could answer during this time period, and I'm sorry we couldn't get to all of them, but I do hope that the session has given you further clarity about what our undergraduate students and families can expect in the coming semester. We will review all of the questions that have been submitted and use those to build out our Q&As on our website that you can access at COVIDinfo.jhu.edu. And so we encourage you to look at that. We also want to remind you that this session was recorded and an archive will be provided on the website similar to other town halls. We are eagerly looking forward to seeing many of our returning students in person, and we're particularly excited to welcome our newest Blue Jays to the nest in the coming weeks. So until then, please stay healthy and safe. Remember to wear your mask, practice social distancing, and wash your hands with soap and water frequently. Good night.